So, and I'm thinking upper limb or doing lower. I don't know. On the anterior front of the body, we can see some of the muscles of the hip, and we can see we can really nicely see emerging from under this inguinal ligament the femoral or femoral nerve, and it comes out and just branches right away into the big muscle across the front of the thigh, the quadriceps muscle that extends the knee. So, and remember, that's the extent of that femoral nerve. The main nerve to the lower limbs on the back side, the sciatic nerve, that goes all to the lower parts or the inferior part of the leg. We can see the start of that sartorius muscle that comes off of the ASIS again, that anterior superior iliac spine, and that's that muscle that crosses across the front of the leg and does that hacky sack or soccer motion that we talked about. And I'll show you the rest of it on the cadaver, on the leg specimen. And then you can see the start of some of the quadriceps muscle that extend the knee. These muscles are what we call groin muscles or adductor muscles. And in general, I'm happy to just have the groups of the muscle groups. If you learn the individual muscle names, that's fine, but the quadriceps has 4 different muscles or 4 heads to the muscle. There's about 4 different adductor muscles or groin muscles. And then what's really nice on this cadaver is you can see this muscle that comes off of the lumbar vertebrae and the iliac internal, what's called the iliac fossa, the interior aspect of that ilium of the pelvic or hip bone, and crosses under the inguinal ligament to the anterior aspect of the femur and flexes the hip. And it's called the iliopsoas, the iliacus part, so named because it's right sitting in, nested in that iliac fossa on the ilium. And the psoas part is this rounded part that actually comes off of the lumbar vertebral bodies. So it's like at the back of it's coming literally off your vertebral column at the back and off the interior part of your hands on your hip ilium bone and crossing under your inguinal ligament onto the front of your femur, and that's the muscle that mostly bends your hip. And if you've ever had that experience, sometimes even just if you've done more running or walking than you normally do, and it feels like when you flex your hip and it almost feels like there's some back pain, it's probably that muscle, because it is literally in the abdominal cavity back there. So hopefully that gives you a perspective on what's kind of a weird pathway for a muscle. That psoas part of it also happens to be the cut of beef that is served as filet mignon, considered to be one of the finest cuts of beef, which maybe that's neither here nor there, but those things help me remember these muscles. So that's iliopsoas. And that's pretty much what we can see on the front. The iliopsoas, the psoas part and the iliacus part. The quadriceps muscle extends the knee, the sartorius hacky sack soccer muscle, and then those groin or adductor muscles. Think about all these muscles are defined by how they would move the legs. So if that muscle is coming off the pubic symphysis region to the medial part of the thigh, think about that from here out to the medial part of the thigh is going to adduct the thigh. Okay. If we look around the back side or posteriorly, now we can see this is gluteus maximus. That's pretty famous muscle in like workout circles or whatever that extends the leg back this way. Forms a lot of the muscular part of the buttocks. If you just do that action and put your hand on that muscle, you'll feel it contract. And then on this side, they've cut through and flapped open the gluteus maximus so you can see gluteus medius underneath. Gluteus medius is the one that it comes off the iliac blade also, but goes laterally to the greater trochanter on the side of your hip, so that when that muscle shortens, it's going to abduct or move the leg this way. But it's the one that we talked about in lecture. What it mostly does is that pelvic tilt, where when you plant this foot, it tilts the pelvis up on the other side. This is a case where you can't group these as gluteal muscles because they have really different actions. So keep them separate. Gluteus maximus, gluteus medius. There's a gluteus minimus. That's a smaller one under there. We're just not going to worry about that one. Okay. So that's the gluteus maximus. Full over here, cut over here. Whoops. And gluteus medius behind it. Because they've cut open the gluteus maximus, now we can see that sciatic nerve coming through and continuing down the leg, although we'll see it really nicely on the limb, on the lower limb specimen. You can see, I mentioned in lecture that piriformis muscle that is probably more often responsible, tension in that muscle. It comes through that sciatic foramen where the sciatic nerve comes out. It also comes off of the sacral vertebrae out to the hip. It's one of these rotator muscles. All of these little muscles here, we're just going to know them as hip rotators, but you should be aware of that piriformis muscle. That muscle gets tense, it presses on the sciatic nerve, and it can cause that pain down the back of the leg that previously was often blamed on those intervertebral discs, but we know aren't always or aren't that frequently the culprit in that pain. So good thing to be aware of. Finally, you can see the start of what are the hamstrings. The hamstrings, I think most people are aware of. That's a kind of a common name, but we use it anatomically. It's a set of 3 muscles down the back of your thigh, very frequently, like it's thought to be muscles that get tight or tense also in our sedentary seated environment. When for people like me who can't touch your toes and you feel that, you know, everybody talks about stretching out your hamstrings. Although I think some people just have longer hamstrings than other people, I don't know. But that's the hamstrings. And so if that muscle shortens back of your thigh, it's going to bend your knee, right? Flex the knee. That's what we can pretty much see on the cadaver. So real quick, gluteus maximus complete over here, cut over here, gluteus medius behind it. Then you've got the piriformis kind of emerging from the sciatic foramen with the sciatic nerve, and then all of those hip flexors, and finally the hamstrings coming down. If we go to the complete limb, this is just really, I mean, they're all beautiful dissections, but here, I wonder if I should put this down lower. Is it okay? Can people see it okay? Yeah? Okay. So just look at, they've given us half of the pelvis with all of the muscles and nerves intact, and this is beautiful, the arteries as well. And so just to get oriented, you see, like here's the lumbar vertebrae, intervertebral discs, and now you've got the sacral vertebrae here, the sacrum, and the little coccygeal vertebrae, and then you have to imagine the other half of the pelvic girdle would come around here to the pubic symphysis, and then you can see the internal part there. And so what you can see so beautifully are these sacral nerve roots for the sacral plexus that then becomes the sciatic nerve that is emerging here through the sciatic foramen down the back of the leg, right along with that piriformis muscle that if it gets tense can press on that nerve and cause that sciatic pain. You just can't get a more beautiful dissection of that than what you see right there. And that's the main nerve down, obviously down the back of the leg. It has branches going out to the hamstring muscle, and then it splits into a tibial and fibular nerve to all of the muscles from the knee on down. But for us, we're just happy to know sciatic nerve coming through there, and I guess the sacral spinal nerve roots that go into the sacral plexus to then form that nerve. You can also see, like, no, I don't want to confuse you too much. You can see that psoas muscle joining the iliacus muscle and coming to the front of the thigh up there. And of course, you can see the femoral nerve emerging with the femoral artery under the inguinal ligament. And that femoral nerve branches right out into the different heads of the quadriceps muscle. On the anterior aspect, you can see they've cut through the quadriceps muscle is all going to come to what's called the patellar tendon and onto the anterior aspect of the tibia with the patella or kneecap embedded inside the tendon. So if they attach to here, it's quadriceps muscles. The sartorius muscle that crosses over the whole front of the leg comes off of the ASIS. They've cut most of it away to expose all of that, but you see the start of it there, and you kind of just follow that. They've just lined it up beautifully, and there's the rest of it continuing down there. I mean, they haven't lined it up beautifully. It connects that way. So that's they just cut it away so we can see everything else. Coming off the pubic symphysis are going to be the adductors or groin muscles. And that's pretty much what we see on the anterior aspect. On the posterior side, again, they've cut gluteus maximus and made a flap out of it, and done the same thing for gluteus medius, so that we can really see, as I was showing before, that piriformis muscle, the sciatic nerve, all of the hip rotators. I don't need you to know any of those individually. And then the hamstrings in their entirety, coming off of actually the ischial tuberosity in one tendon and then splitting out to the two sides of the tibia to, if you think about those muscles shortening, to flex the knee posteriorly. From the knee down, anteriorly, there's this muscle is like tibialis anterioris, but I'm happy if you're just going to know these. There's also digital extensors. Remember, this is the extensor side anteriorly, the opposite of in anatomical position of the upper limb where it's posterior. So just think about ankle and digital extensors. Although in the ankle it's really dorsiflexion like we talked about in lecture, but just thinking about you're extending everything out. Okay? That's good enough for us. Otherwise, we need a whole nother lab for a whole series of muscles. Posteriorly, we're going to see, here I do want you to know this gastrocnemius, or it's really pronounced gastronemius, but we say this, there's a silent C so I say gastrocs or that's the common name, or gastrocnemius or calf muscles. But calf muscles doesn't work, folks. That's kind of a common term, just naming that region at the back of your thigh. This is that muscle that gets loaded as spring-loaded before every step. It comes down to the Achilles or calcaneal tendon, back to the calcaneus bone, and that's the real way to be sure you've got those muscles. There's really three muscles here. It's sometimes called the triceps suri group to distinguish it from the triceps of the upper limb. The three muscles are the two heads of the gastroc and the underlying deeper soleus muscle. But I'm just happy if you know it as the gastrocnemius group or the triceps suri, and easily identified in terms of those muscles coming together at the calcaneal tendon. The foot, the intrinsic muscles of the foot actually are 4 layers deep. At least they're more complicated than in the hand, believe it or not, which is what gives us that incredible sense of balance of, with every step we take. But again, we're just gonna foot intrinsics, or that's good enough. So that's pretty much what we can see in the limb model. There's something interesting, and I don't know, I think this is helpful maybe to just kind of remember how the whole hip region is put together. But trying to think, it might be easier to see this on the torso model. You can see it kind of both ways. No, let's do it here. I'm sorry. We don't worry about arteries really until ANP2, but I hope this will just give you a reference point for kind of orientation to the pelvic girdle. This is the femoral or femoral artery. There's actually that's why I wanted to show you on here. Can we see it on here? No, never mind. The aorta, it's called the dorsal aorta, is the main artery that comes off the heart, arches back, and runs just in front of the vertebral bodies through the whole abdominal cavity. And when it gets to the inferior end, it splits into this, what's called common, again, none of this is for you to know for this part of the class, but this is the common iliac artery, and then it gives off the femoral artery that is the main blood supply to the whole lower limb. And so it comes across the front of the iliac blade. That's maybe where you can almost imagine this better here, if we also look. So the aorta is going to come down the vertebral bodies, and then that femoral artery is going to come through here and go under the inguinal ligament to the front of the thigh. So it's going to cut across the iliac blade, and that's what you see happening here. Cutting across, there's that iliopsoas muscle across the front and down the front of the lower limb. Main blood supply. We would expect the main blood supply to run deep in the limb along with the main nerve supply, which is strangely on the back of the limb. The sciatic nerve, not where the artery is, the sciatic nerve coming off of the sacral nerve roots and going down the posterior aspect of the limb. So again, back to the pelvic girdle, you've got the main blood supply, the femoral artery, coming across the front and down the front of the limb, and the sciatic nerve coming off the sacral nerve roots and going down the back of through that sciatic notch. The other weird thing is that as the femoral artery emerges under the inguinal ligament, right here at the front of the pelvis, if you are not aware of this, you should find it, you know, on yourself or somebody who you know very well, but you can feel a pulse right there. So this is a big artery. This is the main blood supply to the whole lower limb, and it's very superficial right there, and is sometimes injured. I don't know if I have any paramedics, but it's not an uncommon car crash where a piece of metal cuts through that region. A knife injury, it's superficial enough that it can be cut, and if it is cut, like, you know it, you've got a major pulsing artery, and it's a life, or certainly the leg is at risk, and even the life of the person if they can bleed out very quickly from a really severe femoral artery, pulsing femoral artery. So why isn't it going down through here, down the back, along with the sciatic nerve? Well, the problem is, if it were to, as you would think it should, as is usually the case, follow the major nerve, and true, there is the little femoral nerve there, but the main nerve for the lower limb is the sciatic nerve, and it then goes up to join the nerves lower down in the limb. If it goes through there, that's taking it through the entire pelvic canal. And what's the problem if you go through the pelvic canal? You're now in a fully constrained bony space. And certainly, I think you can all imagine, for a pregnant woman at childbirth, there's this very tight fit for the baby's skull as it moves through the birth canal that fills this whole space for what can be anywhere from tens of minutes to even hours, and you would be cutting off that blood supply by pressing against it. And so that's a pretty, an extreme situation, but part of normal anatomy, giving birth. But even for everyday life, you can have enough feces filling the rectum or urine filling the bladder to pretty much constrain this area, and you would also be constraining the main arterial supply if the artery went through there. So it's not just in humans, even other mammals that have very small, they don't have large, a large head on their young that are being born. That's where that femoral artery always comes across the front. It's surely like an evolutionary solution to an unusual route for an artery, but not following the path through that constrained bony space. So again, maybe that gives you all a perspective on what we're talking about. Any questions or anything else that I can clear up on any of, especially the nerve and muscle anatomy? Everybody's good to go?